You know what? I always wondered what that sticky thing was for. Very good.
Can you bring now?
Yeah.
Okay, so we've started recording here. Today is February 13th, 2015. We're looking at your right knee. That's your anterior cruciate ligament. Looks very, very healthy. I like the way that looks. And we're going to come into the medial compartment here. And I can see your medial meniscal tear. Let's just see. Right back here. And this part's going to be flipped under. There we go. That's what's causing your pain, that little guy right there. It always amazes me that something this small can cause so much pain, but that's all it is. So we're gonna get rid of that by using this shaver. I'm not sure. I'm gonna see if I can get it out with the shaver first. Just gotta get the right angle with the shaver to get it out. There we go, now we're getting it. So the unstable portion's been removed. Remember I said it's kind of like a hangnail, and we just take it right down to the base. So now we gotta see what's left of the meniscus and see if there's anything else that needs to be trimmed. Let's see, I will need the concepts. So this part back here needs to be trimmed, and the shaver's not going to hit that just because of the angle. It's the wrong angle for it. So I'm going to have to take that out the old-fashioned way, using the duck bills if you got them. Straight aheads, yep. Okay. So shavers work really well when you're cutting things on the beside the shaver, but the shaver can't cut or chew anything that's right on its tip. So you see this just from the angle of the insertion of the instruments. I got to use something that works well on the tip, which is why these biters work really well. And now we're going to use the shaver here to suck up the excess debris. I'll take a probe next, please. So now what's left behind is nice and stable. So we want to try and leave behind as much of that meniscus as possible because it helps protect the knee. So we don't want to remove too much meniscus. A little bit of wear and tear on the bottom part of the screen. I'll take the shaver, please. As for debriefing, this is a partial medial meniscectomy. Just a little bit of a haircut there. We're going to go on the outside part of your knee, and we'll see what a normal meniscus is supposed to look like. See how healthy that lateral meniscus looks. Looks really, really good. And there's your ACL right there. This little bit of fraying, that's nothing to be concerned about. That's not causing any symptoms. That's not going to get caught in your knee joint. But we're here anyway, so we might as well smooth it. Shaver, please.